Hi, everyone, and welcome back or newly to From Print to Pod. I have Dr. Sulana Misra with me here. She is going to introduce herself, and I am going to interview her on the topic of her article titled I Quit as a Civil Surgeon. This is why. Dr. Misra, could you quickly introduce yourself?
Sure. So my name is Dr. Sulana Misra. I'm a medical doctor in Los Angeles. I have an in-person DPC in Los Angeles, as well as a virtual DPC throughout California and in New York. Originally from New York, I practice internal and integrative medicine. And yeah, I'm really passionate about this topic, especially with respect to what's going on with the current events today. It's July 3rd today.
Okay, wonderful. Now, let's start with the following question that many may have when they're reading this article in particular. What exactly is a civil surgeon?
Sure. So a civil surgeon is a role that any physician can take on. You have to apply to the Department of Homeland Security, the USCIS, for this. So they vet you to make sure that you're a US citizen. They vet you to make sure that your character is good and that you don't have any felonies or anything against you. And then they give you this appointment, which allows you to be part of the immigration process for those that are, it's not really for those that are seeking asylum. It's generally for people who are working here or for, work visas and they want to stay here or get their green card. They want their US citizenship or they get their green card. We are responsible for filling out a specific form, the form I-693, and that is the medical form. The process for immigration is intensely rigorous already. Before this administration took over, the process is very rigorous. So I chose to do this because a lot of DPC doctors already do this as ancillary income. But I also did it because people who come from other countries have medical trauma and have judicial or legal trauma. And I didn't want to be part of the trauma. I wanted to be part of the answer and the solution, showing them that American healthcare doesn't suck. So that was my desire for doing this, besides it also being an ancillary income stream for direct primary care doctors who are setting up their practice. And then usually we continue it.
Okay, so are you specifically doing things like a physical exam that's required, or are you giving them
Yes.
ongoing care?
So it depends. We don't really give ongoing care. In DPC, we can. There are patients that have latent TB, for example, and we need to treat them. There are patients that need a booster for the MMR. We need to provide that and prove that we're vaccinating or they have been vaccinated. We need to go through their records and make sure there's not lying. There's a lot of different things that we do as a medical immigration physician, as a civil surgeon. And like I said, any physician can apply for this job because it's basically check boxes that we do. Um, I'll get more into other stuff as we talk more.
Okay, that makes sense. And let's dive into the first official question is what prompted your decision to resign as a civil surgeon?
The beginning of this year, I was doing a couple of follow-ups and completing some civil surgeon paperwork, and ICE was already doing its raids. And I noticed that my body was the first to notice that this was a problem. I started tensing up and I started locking my door, preventing people from coming into my office. When you are a civil surgeon, how people from the USCIS, new immigrants, or even people that have been staying here for 20, 30 years and just want to retain residency, when they're applying, they look through a list. So I'm on a federal database. And being on that federal database feels like dangerous now. It no longer feels safe. The first thing that prompted me that something was wrong was when the administration decided no more COVID vaccine necessary. That to me, as a internal medicine physician, even though I'm in Los Angeles, California, where I have to fight everyone to get vaccinated, I believe in the vaccine. I have been suffered through COVID. I've had some long haul symptoms. And for an administration to override the CDC and say no COVID vaccine necessary was my first flag. The second flag was when the USCIS refused to tell us that they were no longer requiring COVID as a vaccine. So there was a lapse in communication when all these initial firings were going on, the federal firings, where basically nothing was happening. What I also found out, this is Dr. Vanessa Urbina is a co-civil surgeon. There's several of us, and she's the one who kind of got me into this. She's an awesome physician. And she basically just notified me. We all knew that the paperwork, they're trying to digitize the process. And you know how digitizing for anything medical and anything government related takes forever. The paperwork to apply for this 14-page paperwork that we have to fill out expired March 25th. And the government never updated that paperwork. They never updated that paperwork. So we went through filling out paperwork thinking it was still okay. Patients are being refused. Immigrants that are doing this process right are being refused because the government did not update that paperwork and now it's expired. So there are so many flags in this situation. My body was the first, I listened to my body when it says, look, it's tensing up, this is not right. When the kidnappings started happening, I'm calling them kidnappings because that's what's happening. I'm living in LA, so I'm seeing this go on around me, really, with my own eyes. When the kidnapping started happening, I decided I can no longer be aligned with this organization. What also happened was they started trying to get into my database, my EMR. They wanted to access my EMR for the immigrant patients. But there's no separate EMR for immigrants and non-immigrants. They're all patients. So that means they get access to my regular patients too. That was the last straw for me. That was it. I was like, you guys are not getting access to anything. And so I basically refused to do any assessments or follow-ups with them. And I withdrew myself and I quit. I quit.
Okay, so you mentioned that silence is not neutral. Could
No.
you unpack how ethical considerations influenced your choice?
Medical ethics is something so complicated and it is personal for everybody. You know, when I told some of my colleagues, look, I'm no longer doing this appointment, I gave it up. They were like, we need you to fight in this fight. We still need you. The immigrants need you. And I'm like, I'm a brown woman who's in LA, who is a target myself because people don't know often what my ethnicity is. I don't feel comfortable doing it. So, for my own ethics and safety, I withdrew myself from this appointment. I do think that other physicians need to decide. I understand income is something very important that we talk about all the time because financial literacy for doctors is not something we're ever taught. But financial literacy needs to be discussed. And when it comes to medical ethics and money, we need to sometimes pick a side. So for me, I gave up that income stream to stick with my morals and ethics, which is I will not participate in administration that is behaving in this way, that is illegally masking themselves and trying to enter offices and clinics and hospitals and emergency rooms and grocery stores and just basically taking the safety away from the patient physician connection. I can't do it.
The next question that came to mind actually was answered, I believe, and that was, did you weigh potential consequences personally, professionally, or for patients before stepping away? But you know what?
Yes.
Let's pose it in case there's anything else you want to say about that.
Um, I am hoping there is a change. With every day that goes by, I feel there will be no change. I think we all feel like that. There is literally the bill being filibustered right now by Hakeem Jeffries, trying to get people to call in and say no. Once this bill passes, we are fucked. Medicine is fucked. Medicare is fucked. Medicaid is fucked. Physicians are fucked. With AI coming in, we see further potential replacement and disasters for income down the road. So I do implore physicians to look into how they want to make money, how they want to brand themselves, because staying silent in this moment means you are complicit. It does. I can't be silent anymore. I have to roar like a lion. We physicians are authorities in this space, and people need to listen to us. We're being left out. It's not okay.
Okay, the next question we have is, how did your colleagues, supervisors, or patients respond once they learned of your resignation?
I mean, it was a quiet resignation. So nobody really, once patients get these, I don't even always know if they get the immigration process or if they've been deported after the fact or what happens, unless they tell me, oh my gosh, Dr. Misra, I got my citizenship. And then we celebrate. It's just very exciting. So it didn't really affect my office, but it did affect my income. To be clear, I am still a physician. I'm still a medical doctor. I just finished my ABIM LKA 2 days ago or something, 3 days ago for my batch. So I am still a physician. It's just I'm not a civil surgeon right now.
Okay. The next question is, as someone who spoke out through your departure, do you see this as a model for advocacy, uh, raising awareness by leaving rather than staying and working within the system?
100%. That is why I'm asking, and that's why I wanted to speak about this. I really think that people in federal appointments right now, no matter what they are, need to consider their position, their authority, who they are, and what they're standing for, and if they really want to stand for that. I cannot stand for kidnapping and detaining and deporting citizens and non-citizens without due process. I cannot stand for attacking a group of people just based on their skin color alone. I will not stand for Medicare and Medicaid cuts and not speak about it, even though I don't accept Medicare and Medicaid as payment because I'm direct primary care. It doesn't matter. It's all related. I do hope the direct primary care movement moves because of these cuts if they happen, and physicians and patients can be back at the center of the care model. But, yes, 100%, I think this is an advocacy moment.
Do you intend to continue your medical career in a different capacity, like an advocacy and policy or an activism?
So I don't know. Since I have been speaking up, I have been kind of getting some attention from some people. There is also a group of physicians in Los Angeles women. We just formed a kind of a coalition to just reality share and reality test because within LA, it's hard for us to know what's going on. The media is not really covering the truth that these protests are actually like parades, with mariachi and beautiful singing and dancing. I'm in LA. There's entertainment, there's drag, there's all this really wonderful stuff. They're not riots until later. And there's a complete misrepresentation on what's going on. And that's why so many women in Southern California decided to get together and maybe take some action. And the first action we're doing is having a shared reality because we're piecemealed information. So they know, that I left this appointment. They know that none of them have this appointment. Some of them are working at hospitals. Some of them have private practice. We're all from very different backgrounds, but we share the same view and the same ethics and morals. So that is my activism right now. And I don't know where the future will go.
What do you hope the medical community and patients take away from your story, especially regarding the intersection of work, ethics, and social responsibility?
One thing that we don't touch on is patient data. Patient data protection is very important. We know about cyber stealing, holding these charts hostages. But the fact that the federal government is trying to get into our EMRs and get our patients' social securities or data or addresses or demographics, whatever it is wrong. It is fucking wrong. We have a moral and ethical code, HIPAA, written. We took an oath. We promised, we swore that we're not going to let anything, unless it is going to involve the harm of another person, get between us and our patient. And that's our oath, and I stick by it. And this is harm coming to my patients. So I will stand in the between the harm that will come to my patients. And that's it. I walk away. Sometimes walking away speaks volumes.
Okay, so we are going to close this powerful 15-minute episode of From Print to Pod by asking you if there's anything else that you want to leave everyone with.
I'm going to speak to my physician colleagues who are not civil surgeons. We are voices of authority, and we are getting left out of this movement, of this bill, which involves the health and wellness of millions of Americans and non-Americans. USAID was cut. That was the first thing that was gone after. The other thing is, so we have a responsibility to speak up. That's one. Number two, the other thing is it really breaks my heart that I left this appointment. I'm also mourning this because I met some amazing physicians around the world who unfortunately went back to their own country after all this stuff happened. But one thing that was really exciting is that they learned about direct primary care and they're taking it back to their own country. So this could be a potentially global movement. And that was kind of the community and the joy and the love of me being a USCIS civil surgeon, was expanding this movement and talking about American healthcare, and unfortunately now that can't happen, not with me. So
Dr. Sulana Misra, thank you so much for joining us from print to pod.
thank you so much for having me.